Hi, this is Neuron Loom, and now we are going to study pharmacotherapy of endometriosis. Before diving into pharmacotherapy, let's first understand what is endometriosis. So, endometriosis is the presence of ectopic endometrial tissue at site outside the uterus. We all know that endometrium is one of the layers of uterus. When this endometrial tissue is present somewhere else in the body except uterus, then it is endometriosis. Okay, this abnormal tissue most commonly includes both endometrial glands and stroma, but sometimes it may consist only of stroma. It occurs in various sites such as ovaries, uterine ligaments, rectovagina septum, pelvic peritoneum, large and small bowel and appendix, mucosa of cervix, vagina and fallopian tubes, and laparotomy scars. Now, why pharmacotherapy of this disease is important? Because it causes chronic pelvic pain and dysmenorrhea. Both of this is very unbearable for the patient, and it interferes between the daily activities. That's why it is very important to treat these patients. It also causes dyspareunia and infertility. So there are various theories proposed to understand pathogenesis of endometriosis. The most commonly accepted theory is retrograde menstruation theory, which proposes that during menstruation there occurs backward flow of menstrual blood through fallopian tubes. We all know that this menstrual blood contains endometrial tissues, right? So that endometrial tissue has endometrial cells. When they enter into the pelvic cavity, they get implanted on the pelvic organs, and on exposure to estrogen there occurs their proliferation and growth of this endometrial cells, which causes cyclic bleeding and inflammation. These endometrial cells, although they're not present in the uterus, they're present in somewhere else, but they will bleed at the same time of menstruation for the same period. That's why it's called as cyclic bleeding. It also causes fibrosis, adhesion, pain and infertility. There are also two more theories, that is coelomic metaplasia theory and stem cell theory. Okay, now case of lung endometriosis. So this is a very interesting case that was published in a European Journal of Medical Research in 2013. The case says that a 29-year-old woman has had a complaint of repetitive and consecutive hemoptysis, that is coughing off of blood during menstruation, and 5 ml to 10 ml each cycle of blood clots, which gradually had aggregated. Hemoptysis generally started on the first or second day of each menstruation and thereafter continued for about 6 days, identical with the menstruation interval. And the volume of this hemoptysis increased with the menstruation, and the end of hemoptysis coincided with that of menstruation. So it is a very important case. Earlier this lady was misdiagnosed with pulmonary tuberculosis and was kept on anti-tubercular drugs, but her condition worsened. That's why when radiological examination was done, then this nodular growth was seen in CT scan, and this growth was nothing but endometrial tissue. This is the bronchoscopic picture, and we can see distal bleeding on this picture. Then on radical resection, for the treatment of this patient, radical resection of lingula was done where this endometrial tissue was actually present. So on radical resection, this is the part of lingula, and we can see here the arrow is pointed towards the hyperemic region. Then on the cut section of this lingula, foci of old hemorrhage was seen, and the surrounding was completely hyperemic. So this was very interesting case of lung endometriosis. Now let's dive into pharmacotherapy finally. Because I said that there is chronic pelvic pain and there is dysmenorrhea, it is very extremely painful conditions. So pain management is very important. The first of all, we have to look for pain management. But why pain occurs in endometriosis? It is because there is increased prostaglandin production. Why prostaglandin production is increased? Because this endometrial cells of ectopic endometrial tissue secretes estrogen, and estrogen helps in stimulation of prostaglandins. Now this prostaglandin induces pain through two mechanisms. First is by stimulating nociceptors and second is by hypercontractility of uterus. When it stimulates nociceptors, there is again chronic pelvic pain and dysmenorrhea, and on hypercontractility of uterus, there is decreased blood flow which causes ischemia and which further causes pain. So for the treatment of pain management, we prefer NSAIDs such as ibuprofen and naproxen. Okay. So here in this picture we can see the synthesis of prostaglandins. Okay, prostaglandins are synthesized with the help of enzyme called as cyclogenase. Okay, NSAIDs, they inhibit that enzyme COX-1 and COX-2. Therefore, there is decreased prostaglandin synthesis. So there is decreased pain receptor sensitization and decreased uterine contraction. So patient gets relieved from dysmenorrhea and pelvic pain. Now hormonal therapy. Because endometriosis is completely estrogen dependent disease, we have to manage hormones. We have to give hormonal therapy to the patient. So how hormones actually play a role in this endometriosis is that estrogen causes proliferation of endometrial glands and stroma, promotes survival of this ectopic tissue. Now estrogen अब ये क्या करेगा, वो जो ectopic endometrial tissue that will also secrete estrogen. This estrogen increases inflammation by stimulating production of prostaglandins. I already mentioned that there is production of prostaglandins, but along with prostaglandins, there is also production of cytokines and growth factors. And these mediators, because cytokines and growth factors cause inflammation and prostaglandins will cause pelvic pain. Now positive feedback loop with prostaglandins. What is positive feedback loop with prostaglandins? That estrogen will increase prostaglandin production and this prostaglandin will increase the activity of aromatase enzyme. Now what is the role of aromatase enzyme? Aromatase enzyme converts testosterone into estradiol. So there is again increased secretion of estrogen. Again this cycle continues. Estrogen, prostaglandin, aromatase, again estrogen. That's why this positive feedback loop is also called as vicious cycle of endometriosis. Okay. So now hormonal therapy. The first line hormonal therapy consists of a drug called as progestins. Okay, so what is progestin? Nothing but a synthetic progesterone derivative. This progestin, they will act on pituitary gland and induces, because it is a progesterone derivative, right? It acts on pituitary gland, induces negative feedback and decreases LH and FSH secretion. Further, because there is decreased LH FSH secretion, there will be decreased ovarian estrogen production. And because estrogen, we've seen that estrogen helps in the growth and proliferation of ectopic endometrial tissue. But now because there is decreased estrogen production, there will be decidualization and atrophy of endometric implants. अब यहाँ पे एस्ट्रोजन कम हो गया तो प्रोस्टाग्लैंडिन भी कम हो जाएगा, वो जो मेडिएटर सिक्रेट कर रहा है वो भी नहीं हो रहा है, तो इन्फ्लेमेशन भी डिक्रीज हो जाएगा. एंड बिकॉज ऑफ दैट there will be reduced pelvic pain and regression of lesions, right? So a little bit more about progestins. There can be two preparations of progestins. Okay, natural progestin and synthetic progestin. Natural progestin, example progesterone. Synthetic progestin includes progesterone derivatives and 19 not testosterone derivatives. So synthetic progesterone derivatives में progesterone derivatives में example are medroxyprogesterone acetate, hydroxyprogesterone caproate and megestrol acetate. 19 not testosterone derivatives में examples are norethindrone, norgestrel, levonorgestrel, desogestrel, gestodine and norgestimate. Okay, so these progesterone derivatives have weak anti-ovulatory activity and they have minimal or no androgenic effect, no unfavorable effect on lipid profile. They are not effective orally. Progesterone is not effective orally. It's because of extensive first pass metabolism, so it is usually given by IM route. Okay, so other uses of this progesterone derivatives is contraception, dysfunctional uterine bleeding and endometrial carcinoma. Then next drug used is combined oral contraceptives. It consists of mixture of estrogen, that is ethinyl estradiol, and progestins. What is mechanism of action? So this combined oral contraceptives COCs, they'll suppress hypothalamic pituitary ovarian axis. What is hypothalamic pituitary ovarian axis? It is very simple. Hypothalamus, ये हमारा hypothalamus है. It will secrete GnRH. This will act on pituitary, which will secrete FSH and LH. This will act on ovary or uterus or वो वाला reproductive system, which will secrete estrogen. That is your hypothalamic pituitary ovarian axis. So ये axis को suppress करेगा कौन? हमारा COCs. And that's why there will be decreased production of GnRH, further decreased secretion of FSH and LH. LH का secretion decrease हुआ तो there will be prevention of ovulation and reduced ovarian estrogen production, and lower estrogen levels will reduce stimulation of endometrial implants, which will limit the growth and activity of ectopic endometrial tissue. Okay, and this progestin component included here. वो क्या करेगा? याद करो, प्रोजेस्टिन क्या कर रहा था हमारा? वो क्या करेगा? इट विल कॉज एट्रोफी. प्रोजेस्टिन क्या कर रहा था? प्रोजेस्टिन नेगेटिव फीडबैक करके एफएसएच एलएच का सिक्रेशन डिक्रीज़ करके एस्ट्रोजन का डिक्रीज़ करके प्रोस्टाग्लैंडिन डिक्रीज़ कर रहा था, और एस्ट्रोजन डिक्रीज़ हो गया. सो देयर विल बी अगेन डेसिडुअलाइजेशन, और पेन भी कम हो जाएगा क्योंकि क्या? प्रोस्टाग्लैंडिन सिक्रेट नहीं हो गया. ओके, देन नेक्स्ट ड्रग इज GnRH एनालॉग्स. इसका एग्जाम्पल क्या क्या है पहले ये देखो. ल्यूप्रोलाइड, नेफारेलिन, ब्यूसेरिलीन, वोसेरिलीन, ट्रिप्टोरेलिन. ओके, अब जब इसको देखो, इसका मैकेनिज्म अच्छे से देखो. जब पल्सेटाइल एडमिनिस्ट्रेशन करते हैं, मतलब जब इनिशियल थेरेपी होती है ना GnRH एनालॉग के साथ, तो GnRH के जो रिसेप्टर है उनको सडनली बहुत ज़्यादा GnRH मिल गया, तो वो क्या करेंगे? बहुत ज़्यादा FSH एंड LH को रिलीज़ करेंगे, तो उसकी वजह से ओव्यूलेशन होगा. बट ऑन कंटिन्यूस थेरेपी क्या होगा? इनिशियली तो गोनेडोट्रोपिन, मतलब ये FSH LH का सिक्रेशन तो बढ़ रहा है, बट लेटर आफ्टर 2 weeks देर विल बी डाउन रेगुलेशन ऑफ GnRH रिसेप्टर्स. क्यों? अगर कंटिन्यूसली GnRH रिसेप्टर्स को इतने ज़्यादा क्वांटिटी में, लाइक कंपैरेटिवली GnRH एनालॉग्स को, मतलब GnRH को ही एक्सपोज किया जा रहा है, तो वो रिसेप्टर यूज टू हो जाएंगे, एंड देर विल बी डाउन रेगुलेशन ऑफ दिस GnRH रिसेप्टर्स ड्यू टू प्रोलॉन्ग्ड ऑक्यूपेशन बाय GnRH, और उसकी वजह से देर विल बी डिक्रीज सिक्रेशन ऑफ FSH एंड LH, suppression of ovulation, decreased estrogen production, and the same cycle continues. Then there are GnRH antagonists. Now this GnRH antagonist example is cetrorelix, ganirelix, abarelix, degarelix. This will completely block GnRH receptor in antipituitary, will inhibit FSH LH release, decrease in estrogen, and same cycle continues as we have already seen. Now there are aromatase inhibitors. Okay, so we have seen this. Aromatase is an enzyme helpful in production of estradiol from testosterone. एग्जाम्पल ऑफ एरोमेटेज इनहिबिटर्स. तो हमें एस्ट्रोजन का जो सिक्रेशन है वो बंद मतलब कम करना है ना, बिकॉज इसकी वजह से तो प्रोस्टाग्लैंडिन हो रहा है, इसका पूरा डेवलपमेंट, ग्रोथ, प्रोलिफरेशन एक्टोपिक एंडोमेट्रियल टिश्यू का हो रहा है, तो इसको हमें क्या करना है? इसका सिक्रेशन हमें कम करना है. तो उसके लिए हम एरोमेटेज इनहिबिटर में क्या क्या यूज़ करेंगे? लेट्रोजोल, एनास्ट्रोजोल एंड एक्जिमिस्टेन. उसमें से दिस एक्जिमिस्टेन इज़ इरिवर्सिबल एरोमेटेज इनहिबिटर, एंड लेट्रोजोल एंड एनास्ट्रोजोल इज़ रिवर्सिबल inhibitor, and they can be administered orally. Then last drug is danazole. So danazole is synthetic androgen. Okay, because ये androgen है, it will stimulate androgen receptors, and there will be androgenic effects. These androgenic effects will lead to secretion of low GnRH, which will lead to secretion of low FSH, low LH, with low estrogen, low progesterone, and there will be unfavorable environment for the growth of endometrial tissue. इसका एडवर्स ड्रग रिएक्शन ये है कि इट कैन कॉज हॉट फ्लशेस, एमनोरिया, हर्शरिज्म, मसल क्रैम्प, GIT, साइड इफेक्ट्स, हेपेटोटॉक्सिसिटी इज कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी. ओके, ट्रीटमेंट एल्गोरिदम क्या है? माइल्ड सिम्टम्स है तो NSAIDs देना है. पर एंसर्स देना ही पड़ता है पेन मैनेजमेंट का, पता नहीं कुछ भी हो जाए. देन फर्स्ट लाइन थेरेपी में यू विल गिव प्रोजेस्टिन्स एंड सीओसीज जो हार्मोनल थेरेपी है प्लस एंसर्स. एंड सेकेंड लाइन थेरेपी में यू विल गिव GnRH therapy and aromatase inhibitors or surgery. Okay, so that was our pharmacotherapy of endometriosis. Thank you.